Hi, thanks for talking to me. I appreciate it. Enjoying the show. So to start out, what was it about it that made you want to be a part of it? And was it everything you expected?
Yeah, look, I wish I had enough work being thrown at me that I could just pick and choose my favorites. Not that I wouldn't have said yes to this, I certainly would have. But, like a lot of gigging actors, I'm just, hustling for the next gig. And it helped that I had a working relationship with the creators on Superstore previously. And so knowing how they worked and knowing firsthand the quality of that show, well, it made it a very easy decision. I was not that hopeful that I would get the job, because this industry is like 95% of the time you don't get the job. But when it came through, it was like a dream come true. It was just a fantasy job. But what I didn't know at the time and found out pretty fast that it would be the favorite job I've ever done. And I say that without exaggerating. It was just a joy to be on that set every day. I would look forward to coming to work every day, and that doesn't always happen.
No, it doesn't. What can you tease that's coming for your character? I know I've seen the next two, but for people who haven't seen it, what can you tease?
Oh, in the next two, yeah. Well, there's the upcoming Christmas episode. Happy holidays. It's tis the season. A very yeah. I mean, hospitals don't close on Christmas, and nor does Saint Denis, and a lot of hijinks ensue. For Bruce, particularly, he has to deal with a marriage proposal gone slightly awry.
Just a little bit.
Little, yeah. But yes, in a sort of not safe for work patient experience, but Bruce is there to save the day with or without the use of his katana. But you'll have to watch to find out. And then after that, we get to explore one of Bruce's phobias. In the form that of needles, of receiving needles, and that's a particularly great episode where he goes to extreme lengths to avoid getting his blood drawn at work. Yeah.
Well, let me ask you, what are you afraid of? Just personally,
Oh
Josh.
my God, so much. I'm afraid of spiders. I don't like spiders. I know that's really,
Okay.
but an unusual one. I get really anxious when I drive over train lines, and I don't know why. When you cross like railway tracks or whatever, it's simple. They're all the time. I get really anxious doing that, and I don't know where that's come from. So that's something of an irrational fear of mine.
All right. What do you find difficult about this? Obviously, you change your accent because I did not know that until I talked to you. So you're doing a good job of it, but is that
Thank you.
difficult?
No, no, not now. I've been doing this gig. I mean, I've been in this industry for God 35 plus years, so awfully long time. But the accent stuff. I mean, I'd lived in the States in LA for 15 years up until 2020, and so at the end of that experience, talking in an American accent was really second nature. I would do it quite often. And most of the work I had done was in the American accent, so that muscle became quite strong. But I think what also helps is that once I turn up to work in the mornings at St. Denis, I stay in the American accent all day. So not just in front of the camera, but when we break for lunch and just socializing with the crew and the cast, I'm talking the American accent the whole time. So there are lots of members of the crew who have never heard me talk in my Australian accent because I've only ever been American around them, and I think that helps a little bit. Yeah,
Yeah, maybe it would be harder if you went back and forth. I don't know.
it is for me. Some actors are good enough to do it. I'm just not that good. Yeah.
Well, I wouldn't have known it. So, all right. Well, thank you so much for your time. I appreciate it. Look forward to seeing the rest of the season after these new ones.
Yes. Thank you, Jamie. I appreciate the
Thanks.
chat.
So, have a good rest of your day.
You too.